Hello, I'm Dr. Gaayathri, physician from Endocrinology Department of Hospital Queen Elizabeth II. I am here today to give you a short talk about diabetes. The prevalence of diabetes in 2019 in Malaysia was about 10%, and 25% of the population had abnormal blood sugar levels, and that is 1 in 4 people. Among native Sabahans, the rates of diabetes were about 11%, and about 5% of those were people with known diabetes, and the rest were people who had not known that they had diabetes. So if you're wondering if you should get tested, if you are experiencing symptoms such as feeling thirsty all the time, feeling hungry all the time, you find yourself passing urine more frequently than you should be, and you're feeling tired all the time, then these are symptoms that are suggestive of diabetes. And yes, you should get yourself tested. However, if you do not have these symptoms, but you are above the age of 30, if you have a BMI of more than 23 kilograms per meter square, if you are a female with a waist circumference of more than 80 centimeters, or if you're a male with a waist circumference of more than 90 centimeters, and you have someone in your family suffering from diabetes, then yes, you should get yourself tested as well. So if you're wondering, how can I get myself tested? A very simple and easy way of getting tested is just using a simple finger prick test with a glucometer. And if your fasting sugar levels are more than 5.6, or if your random blood sugar levels are more than 7.8, then you actually do need additional testing to confirm if you are suffering from diabetes. Now, if you are somebody who's already pre-diabetic or diabetic, a good understanding of your disease is key in ensuring a very good control of your diabetes. Other than the medications that you are receiving from your doctor, a well-balanced diet and a healthy lifestyle is very, very important. If you find that your weight is higher than it should be, achieving optimal weight loss is of utmost importance. And this can be done by reducing the amount of calories in your meal. Now, calories come from carbohydrate. The main calories in your meal come from carbohydrate, and these are rice, noodles, bread, sugary food, or any sugary drinks as well. So try your best to reduce the carbohydrates in your meals and add more nutrients such as vegetables, fish, and meat. Also, it is very important to try to incorporate some regular exercise every day, and these are usually exercises that have cardio in them, like jogging, running, cycling, or even swimming. And try to do this for at least 5 times in a week. So for 5 days and for 30 minutes a day. For those of you who are already diabetic, regular sugar monitoring is also very, very important. You can do that by using your glucometer and your finger prick test at home, but you can also do it using something that we call a CGM, which is continuous glucose monitoring. So this will tell you how well controlled your sugars are and how your diabetic control is. So this is what a CGM looks like. It comes with a machine as well as a sensor. And unfortunately, we do not have this in our clinic, but you can buy them from any pharmacy. They come together for a price of between 500 to 600 ringgit. And this sensor, you can see, is a small white sensor that you can attach usually to the back of your arm. And once it is on, it lasts for 2 weeks, which means after 2 weeks, it has to be removed and disposed of. And this machine can be used even after the sensor has expired. You get a new sensor and you can continue using it with the same machine. So once you have the sensor attached to your arm, all you need to do is bring the machine close to the sensor and you will get yourself a blood glucose reading. So why is this better than a glucometer? Is because you can do it as frequently as you like, and you do not need to prick yourself all the time like when you use a glucometer. And I also think it's a good way for you to understand how your meals are actually affecting your blood sugar levels. If you have purchased this from a pharmacy and you have difficulty putting them on, then you can approach us in level 3 in endocrinology clinic and we can help you put the sensor on. And if you have any further questions about the CGM or about diabetes, feel free to approach us, any one of us in level 3. And in conjunction with World Diabetes Day, we are organizing a virtual run on the 1st of October. You can find more details in the pamphlet in front of the entrance of the Radiology Department. There's a QR code and you can scan that and register. Please join us if you are free. Thank you. I hope this talk was helpful.